in anesthesia, catastrophe, and remedial measures. As anesthetic and OT technician, we work in such an intense place of OT or ICs where errors are bound to happen. Sometimes it is intentional, unintentional, but most of the time it is unintentional and or avoidable. So we have to minimize that avoidable situation. So I start with this popular saying, to err is human, which means human, it is normal for people to make mistakes, but we have to learn from our mistakes. So lot of us, or most of us, have visited OT and seen the case in spinal anesthesia. So here is a case. He was a 30-year male posted for appendectomy under spinal anesthesia. After 1 or 2 minutes of spinal anesthesia, patient complained of back pain, burning pain in both lower limbs. Then patient became restlessness and had a tonic-clonic conversion. But normally what happened after giving spinal anesthesia? Patient don't feel any sensation in the lower limb. But here what happened? Patient had a tonic-clonic conversion. So what's the reason? Here the reason of drug identity. Here both drug, bupivacaine, basically we use for subarachnoid block, and Trenexa, which is used for clotting of blood, has been errored. And someone has given Trenexa in excess of bupivacaine to patient. So that's why patient had a tonic-clonic seizure. So coming to the introduction, the incidence and significance of drug error during anesthesia are underappreciated. So medication error are common throughout the healthcare, and in USA it is around 1 lakh to 4 lakh deaths annually, and error occurring 5.3% of medication administration during surgery, and which 70.3 medication error were deemed preventable. So what is drug error? So any preventable event that may cause or lead to inappropriate medication use or patient harm while the medication is in the control of healthcare professionals, patients, or consumers. Just wait a second.
Yes, sir. The slides are changing, sir. Fine. It's fine.
Yeah. Okay. So what are the type? Let's see what are the type of medication error. Medication error I have talked about. Adverse drug event, any injury related to the use of drug. Prescription error, a prescribing decision or written prescription resulting in unintentional significant. It is maybe because of reduction in probability of treatment being timely or effective, or increase in the risk of harm. Or at the time of drug administration error. Administration of the drug, wrong dose, wrong rate, or wrong formulation or concentration, wrong route, wrong time, or maybe wrong patient. And what is the dose error? Administration of the wrong dose of a drug. And what is adverse drug reaction? Any response to a drug which is noxious and unintended that occur in a dose normally used in a man for prophylaxis or diagnostic or therapeutic use. So in general, we see, what are the patients? Which patients are more risk of medication error? Patients who are on multiple medications, patient with another condition like renal impairment, pregnancy, patient who cannot communicate well because they cannot tell about their medication history. Someone else will tell about their medical history. Patient who have more than one doctor, so maybe they are taking multiple medicines from more than one doctors. And patients who do not take an active role in their own medication use, and someone else is providing medication to the patient, and children and babies because they cannot give history to doctors. So how prescribing go wrong? So basically, when there is inadequate knowledge about drug, indication and contraindication, not considering individual patient factor such as allergies, pregnancies, comorbidities, and medications, Wrong patient, wrong dose, wrong time, wrong drug, and wrong route, as I told you earlier. Inadequate communication and mathematical error when calculation dosing is wrong. Looking to the risk factor for error during anesthesia. So, what are the risk factors? Maybe unfamiliar setting. कोई भी technician or doctor goes to a new OT or first time in the OT, so that setting is very new to him. He don't know where are the drug stacks, where are equipments are there. So it is an unfamiliar setting to him. New drug packing or ampoules, syringe prepared by another. Someone has prepared the drugs and someone else has provided drug to anesthetic. So here risks of errors are high. Handwritten label use, sometimes what has been written in by hand is not readable by person, poor lighting condition, multiple medication, failure to label syringe. As mentioned by earlier by Dr. Karthik, it is very important to label syringe individually or color coded. Incorrect matching of label on syringe ampoules and failure to read label on vial ampoules. So, where preoperative process for medication use? For on which process we use medication? So, first we start with the medication selection. If there is a patient, you're going for a general anesthesia. So you want an induction agent like propofol. So you have selected the propofol. So you ask for the propofol. Then you have to prepare according to the dose, weight of the patient. You have to prepare. Then administer the patient. And after that, document and monitor what the effect of the drug to the patient. So looking for the practical classification of medication during anesthesia, maybe at the preparation of drug, sometimes the syringes are not labeled. You are not checking the label, including the expiry date prior to administration, and different concentration in the syringe and incorrect label. Administration of drug, wrong patient identification, you have given an incorrect dose, excess or inadequate. Different person has been used for preparation of administration drug. There has been syringe swapping. It is most common of drug error in anesthesia or syringe swapping. When syringes are not labeled and it has been swapped. Like pre-medication, you want to give the pre-medication. It has happened with me once in the residency time. I have given rocuronium instead of ranitidine. So we have timely intervened the patient. We have seen this patient had a falling saturation and we intubated at that time. But it bound to happen. So sometimes it is avoidable, sometimes it's not avoidable. But you have to be very vigilant in the OT when you are giving drug to the patient. Wrong route of administration. Sometimes patient has an arterial line and it has been reported many times. Some drugs has been given to the patient instead of intravenous are given into the arterial line. Incorrect timing of administration, omission, repetition or substitution of drug. And at the end, recording of the drug delivered. Sometimes we do not recognize adverse event and reluctant among doctors to admit the error. Once you have given wrong drug, you have to admit, okay, it's happened to us. But most of the time, we do not admit we have given a wrong drug to the patient and failure to report an error during medication. So, what are the timing of the medication error? So, in the one study, it has been found most common is during middle of the anesthesia, 42%. At the induction, it is 28%, and at the beginning of procedure, it is a 17%. So, when to suspect? How you suspect you have given administration a wrong drug to the patient? Like in the first case, I told you, someone has given Tanaxa acid instead of bupivacaine heavy to the patient. So patient at that time, patient was visible had a tonic-clonic seizure in front of you. So you may know that there is some mistake has happened. You have given wrong drug to the patient. So extreme or unexpected increase or decrease in blood pressure or heart rate, unexpected or persistent muscle relaxation. So in the end of surgery, you have to give reversal glycopyrrolate instead of you have given vecuronium. So that time is prolonged. Muscle relaxation time is prolonged. Unexpected change or lack of change in level of consciousness and incorrect ampoule found to be open in working area. So type of drug involved in errors. So it has been found that local anesthetics around 9.3%, they're involved in error. Inhalation agent for 13.2, opioids 11.7, succinylcholine, muscle relaxant 17.1, and miscellaneous is 22%. So there are 12 simple rules for anesthetists to maintain a safe medication administration process. So we have to look for and follow. First is only handle one medication at time. If in morning you go into the OT and you have asked to prepare a medication, you have prepared only one medication at a time. Do not collect all the syringes and vials and you try to make all the drugs in a hurry. No, only handle one medication at time. Distraction. Whenever possible, do not allow distraction or answering of question while preparing in medication. It happened to all of us when we are in OTs. Many of our friends are with us, and we in the morning we used to chat and talk about our daily routine. But we have to avoid this distraction. So this is a very good cartoon I found on the net by Dr. Ganesh Chaudhary. A patient is in the OT and the surgeon was operating and anesthetic is saying out. So what? Surgeon asked, what, patient is out? No, is clear is out. So we have avoid all the type of distractions in the operation theaters. So check every wire twice, once before trying and once after labeling. You have to check for the expiry date and